We're introducing today the Hepatitis A Prevention Act. Obviously, there's something going on around the entire state of Florida, many states, but certainly the state of Florida. Over 800 documented cases, something like 18, 19 cases in Martin County alone. Previously, we were working to make sure that our local clinics here in this ground zero kind of area, our VA clinics, had access to these vaccinations for things like this, for hepatitis A. But we're also working to make sure that in a case like this, where we all know an ounce of prevention is worth a pound of cure, that agencies like CMS are making sure that in at-risk areas like this, very prone areas, that they are offering those hepatitis A vaccines as well. And so this is something that it's important. It's something that I've had the opportunity to speak to other people about the need for this, like great commissioners, like the person that just walked up behind us here. Mr. Camp, you want to come up here as well? All right, he doesn't want to come up, but had the opportunity to spitball things like this with him, saying there's a need for this. Let's try to make sure these at-risk areas have access to these very preventative tools that can help to save a lot of resources and help to stop the spread. So that's what this bill is all about.
So what prompted it? I mean, did people call your office and say, I can't get the vaccine? Why
Well,
do you think we need this?
There have been a lot of conversations about folks not being able to get the vaccine, about the price different people are paying in terms of co-pays. I started seeing this very initially as I was working through the Department of Veterans Affairs, saying, okay, what are the most at-risk populations? Some of the most at-risk populations for hepatitis A are the homeless population, those that have promiscuous sex or using needles or things like that. Those are at-risk populations for hepatitis A. So within the veteran community and the homeless veteran community, we're saying locally, does the VA have the vaccines that they need? Initially, the local Stewart Clinic did not have those vaccines on hand, so we had one of the undersecretaries down. We spoke to him about it. He made sure that they got those vaccines over at the local clinic so that those were available. But looking at that more broadly, saying if there's an outbreak situation, a governor looks within his state and said, this is an outbreak situation, we need to be aware of this and we want to stop the spread of this. Why not make sure that Center for Medicare Services can go out there, CMS can go out there and make sure that this vaccination is being offered by those that need it.
No insurance.
If you are in an outbreak area, we want to make sure that there's prevention available. So if a governor is declaring this an outbreak area, that is an emergency situation. It's an emergency situation that can be prevented through important things like hand washing, good sanitary conditions, lifestyle, but it's important to make sure that the vaccination is readily available in a situation like this as well.
Congressman, are you disappointed right now with where the health department stands and there's still a long way to go?
I'm not disappointed in the health department. It's been difficult for them. This is not something that's easily identified. We were all at the same press conference at the sheriff's office before where, they make the important distinction of when you're looking at something that's transferred through mosquitoes and things like that, where mosquitoes may not travel more than a couple hundred yards in their life, you can identify where something's coming from, where to stop something, how to actually prevent it. When we're talking about something that's being transferred from person to person, that, I just look at my day. My day started this morning, way up in Orlando. I'm here. I'm going to be down in Palm Beach later. And folks have days just like that constantly, where you're across different counties, across different states, maybe even across different countries. It's not easy to identify. And so in that, I'm glad that they're out there trying to seek, assistance and try to identify this, but I understand that it also takes a moment to do so.
And there are people out there right now, because of the dormancy or the latency period, 2 to 6 weeks, there are people out there right now who could possibly have this, and then it could possibly go to another person. So this could essentially, while health officials are working on trying to find out the source, this could essentially get worse, even worse.
Yeah, there's no question that this is a situation that can get worse. You pointed out that there's a dormancy period that exists with this, and that individuals may not know that they're in fact infected at this moment. And this is where it becomes important, where we discuss these prevention tools. Number one, just good hygiene. Make sure you're washing your hands constantly, that you can do what you can in your own life to prevent contraction of something like this. But then if you consider yourself certainly at risk, or if you want to take an additional precaution and be vaccinated, go out there and have that done as well. Make sure that that's available, especially in at-risk areas.
What do you say to people who say, I don't need this. I'm not going to get this.
Same thing I said already. Ounce of prevention is worth a pound of cure. Look internally at your own lifestyle. If you think that your hygiene, the way that you're living is going to keep you safe, certainly, look at that self-respectively. But if you think you might be at risk, you might want to look at the vaccination. If you want to, just like we look at the flu vaccination each and every year, is it something that's important based upon what's going around the community? People often look at the flu vaccine in that way, deciding whether they're going to get it during flu season. Well, this is a moment that there is an outbreak going on in this area. People should judge for themselves. Are they at risk? Are they worried about that? Are they worried about the effects of that? And if so, take the appropriate precautions, vaccination being one of them.
Do you take issue with what some might call a delay in the health department getting the information out there to the public?
Anytime that there's a delay, it's frustrating to people. It's frustrating to officials that want to go out there and get the word to the people that have their ear, that are listening to them, that they can't spread the word to people in other agencies. It's frustrating, but I also respect that the health department doesn't want to send misinformation. They don't want to create any sort of emergency clamor where it might not exist, to say, leading people, well, maybe it's in this area of the food industry, or maybe it's in this part of distribution or this part of restaurant. If they say something that's irresponsible like that, there are far-reaching repercussions, and I respect that they don't want to go out there and get ahead of their skis, as people say.
Why was it so important for you to get up there? Why was it so important for you to get this out there?
When you're a representative, one of the most important thing, probably the most important thing that you can do, is always look at what's going on in your community. You're put in a lane that you have the opportunity to go out there and help people. Hopefully that's why you're in that lane. And so when you see an emergency going on in your area, just like our county commissioners have seen the emergency going on in our area, you're doing everything that you can. You're on high alert saying, who can I speak to? Who can educate me about something that I may not know all the facts on because it hasn't been my area of expertise? What in my lane is going to allow me to go out there and help prevent other people from contracting this or stop the spread of this, stop further damage into our community? And I think across the board, you've seen, our elected officials at all levels saying, we don't want to see the spread of this. We take this very, very seriously, and whatever we can do in each and every one of those lanes to help stop the spread of this and in any other place that this could pop up, let's drill down on that and make sure that we work on that. And so,
when you first heard of this, did you ever expect something like this would happen here in this area, in your area?
this was the last thing on my mind that I expected to see happen. I can't say that it wasn't that long ago that people are asking me, hey, did you go out there and get the flu vaccine? Are you going to get it? So I was thinking about that sort of thing peripherally, but this was not something that I expected to see pop up in our area. But when it does, this is where folks step up and they say, what can we do? Okay, that's something that we can do. Let's go do it.
What are your feelings that this is going on in our area, being your family lives here?
I think about my wife, I think about my 4 children, one of them being an infant, and we do what we can constantly. Every time I see my kids and we're about to sit down at a restaurant or we're going somewhere else, I'm reminded in my mind, hey, go wash your hands. Every time I'm thinking about grabbing something, whether it's a stick of gum or a piece of bread at a restaurant and I'm about to put that in my mouth, I'm thinking, man, when was the last time I washed my cans? When was the last time that I washed the head of my cane, which is constantly in my hand that maybe doesn't get washed as often? When's the last time I touched my door handles or something that I don't wash, quite as often as I might wash my hands? When's the last time I shook somebody else's hand? And now I'm thinking about those things constantly and saying, hey, before I do that, let me go and put some sanitizer on. Let me go hit the bathroom and put some real soap on it, scrub it for that good 20 or 30 seconds, and make sure I'm trying to prevent it for my own family and myself.
And just last question, we talked about this earlier about people not taking it seriously, but then you have three people I believe, who are dead because of this. I mean, washing hands, we're talking about all this, and your family as well, and the families here. Talk about, people who don't necessarily take it seriously. We're talking about 3 other people dead.
Yeah, most important thing we could say, when we're given warnings about anything like this, take it seriously. Elected officials are out there giving warnings for a reason, because there's a very serious threat to individuals. And yeah, there's always the old sentiment of, it's not going to happen to me. It can't happen to me. That happens to someone else. That's the truth until it happens to you. Take it seriously. go out there and utilize the precautions that are available, especially if they're made easily accessible. You know, like I said, for our veteran community, go to our VA clinic. You know, if you're covered with insurance, go out there and you know, get that vaccination. If you don't want to get the vaccination because you don't feel the threat rises to that for yourself, make sure you're practicing good hygiene. If you're in one of those at-risk communities or you're at an at-risk point in the way that you're living in your life, be self-reflective of that on a number of different fronts, but certainly about the spread of hepatitis A, and do something about it.